So for our next topic, Trent, I'm pretty excited about this one because I've heard you describe it several times and it could be really comical. But the reason I'm bringing it up is that I hear a lot of people say that, well, I don't really have any trauma, I have a great life. And I've heard you reply, just being born is a trauma. So
Yeah.
let's take it from a baby's perspective. So
Yeah.
I would like to hear you explain that again.
Yeah, the birth trauma is a trauma that we deal with in infinite healing. Oftentimes it's associated with a technique called conscious connected breathing, and I have a technique called infinite breathing that works with the birth trauma. And the birth trauma acknowledges the fact that your mind is like a computer, and so the computer has different programs in it that are deciding what it is you're going to be doing in your life and the outcomes that you're going to have. And the foundational program in that hard drive is your birth. So the way that you were conceived and the way that you were when you were gestating, when you were in the womb for 9 months approximately, and the way that you were actually born becomes the operating system for the computer. It's the first program that was put into the computer that all of the other programs that you develop and all of the things you learn as a child are based on. So when we think trauma, a lot of times they talk about, well, the things that were programmed into me from the time I was age 1 to the time I was about age 5 or 6 is basically what decides my personality. But it's actually before that decides the foundation of who you are, and that's called your birth. So if you understand from a baby's mind what the birth is like to the baby or is like to the fetus, and being in the womb, it gives you an understanding about how this becomes such an important program in the hard drive of the computer. So if you think about being in the womb, not from an adult's point of view, but from the fetus's point of view, and this is just your average birth, which people say, I was born and there was no trauma. Well, this is just what people call a no trauma birth. And then you have extenuating circumstances such as cesarean section and forceps birth and breech birth, and this is just talking about a normal face presentation regular birth. So imagine you're sitting in a womb, you're a little fetus, and you don't know anything about anything, your mind is completely fresh, and you're floating around in this liquid environment. It's dark, you can't see anything, and you are surrounded by mother, and mom is basically the mind that you pick up on. So her thoughts, her feelings, and the things she puts into her body are the things that start to nourish you, and it becomes the thoughts and the emotions that you think for yourself. So you don't know the difference between yourself and your mother and the immediate environment, including father and other people that might be around, but in particular the mother. So you're a little fetus, you're just starting to grow, it's very dark, you don't know what's going on, but all of your needs are being met by the umbilical cord. So that means that your nourishment needs are being taken care of. You don't have to fend for yourself. So while you're in the womb, you're also picking up on how your mother feels, what she thinks about the world, what she thinks about her environment, and that becomes what you think is the world is like also. See, that's what you think the environment consists of, is her perceptions. So when you're born, you think the world works the way that your mother thought that it worked. And so you're in the womb, and for the first 3 to 6 months, you're floating in there and everything is pretty much fine. All of your needs are taken care of. There might be a twin. 80% of all births start out as twins. So somewhere along the way, one of these babies gets absorbed into the bloodstream, and that can become the feeling of missing a soulmate, is the fact that you started out, 80% of all births start out as twins, and then one's absorbed into the bloodstream, and so you feel like you're missing a soulmate. So the next 6 to 9 months is spent maybe missing your soulmate. 6, 7 months, the baby's fetus, the fetus is growing, and it starts to feel like the walls are closing in on it. There's not enough space. I don't know what's going to happen to me. Is there room for me to grow? And At about this time, that feeling is predominant. There's not enough space, and there's this feeling that something is going to happen. There's going to be a transition. Around the 8th or 9th month, the baby, 9 months, the baby initiates the birth. So the mother doesn't decide on the birth, it's the baby that releases a chemical. And this chemical starts the birth process. So 9 months, now all of a sudden, there's very little space. I don't know if I can make it. I'm trying to survive. All of a sudden, everything changes. You are pushed, because of the mother's contractions, you are starting to be pushed down the birth canal. So it actually feels like the baby is getting a massage in this liquid environment as the contractions are causing the baby to get pushed down the birth canal. You don't know where you're going. You don't know, you just left the only environment you've ever known, this nice womb, been providing all your nourishment. You're being pushed down the birth canal. Where am I going? I don't know what's going on. Am I going to make it? Am I going to survive? This is baby's mind. All of a sudden there's a light at the end of the tunnel. And this is the hospital room, if you're born at a hospital. So you start to go down the birth canal, all of a sudden you see hands. You never seen hands before. And maybe the doctor's had a good day, and hopefully, if not, he might not be in a good mood, then he's going to start to grab at me. He's going to pull on my head, and nobody's ever touched me before, and he's got big hands, and he's starting to pull me out of the birth canal, he or she. And so a baby is totally sensitive, way more sensitive than we give it credit for. And so how gently the doctor handles the baby becomes its first experience of the world and of touch. So you're getting pulled out here. It's like the doctor's taking me from my mom. All the things that I've known are changing. So they get pulled out by the head. Next thing that happens, they're going to flip you upside down and try to get you to breathe. You've never breathed before, so you don't know what it's like to breathe. So the doctor hangs you upside down. Now you're hanging by your feet. You're still attached to the umbilical cord. Your mother's laying there. It's bright lights. All these bright lights. You've never seen light before. Operating room lights, totally bright lights. So now you're blinded. So the baby actually starts out being able to see. Then they have these bright lights. So the baby is squinting, can't see, then hanging upside down in gravity. Is the doctor going to drop me? They know what they're doing. And the next thing they do, they try to get you to breathe. I'm cold. I just went from 110 degree environment, totally warm, and now it's freezing. 70 degrees, 72 degrees, 68 degrees. It's like going from a sauna to the Arctic. And so I'm totally freezing, hanging upside down. So the doctor is going to get me to breathe. Whap on the butt. So now I go, oh my God, I'm breathing. I've never breathed before, and I'm hanging upside down, and I just got hit. So now my first experience of life, I've been abused. I'm hanging upside down, and they just took me from my mother. Then they're going to take away my food. They're going to cut the umbilical cord. Only food, nourishment I've ever known. They're going to take that away from me and cut the umbilical cord. Now I'm hanging upside down. They're going to take me and put me somewhere else away from my mom, and the only thing I've ever known is life, and they're going to start to do tests on me. They're going to scratch my feet. They're going to put nitrate drops in my eyes. Now I'm blinded. I can't see. It's cold. My mom, where is she? Am I going to make it? I'm in a little pan. They're weighing me and doing all these things. And this is before I've even had a meal yet. So the baby, the poor baby, is freezing, doesn't know what's happening. This is our first experience of life. And so you can imagine how that makes us think about how life works. We start to think life is pain, life is trauma, life is difficult. I need help to get taken out of the womb. I need a team, anesthesiologist, doctor, and a team to make it. So these are things we start to think about life. This is a normal birth. Then you have extenuating circumstances, emergency situation, cesarean section, breech birth. All of these different factors affect the hard drive. So you can imagine how this affects and how strongly this affects your mind. So I recommend people learn about this and research the birth trauma at www.lulu.com/Trent Inspires, or at my email, trentnelsonInspires@hotmail.com. I can help you release this trauma, and there are techniques to do that through infinite